Hi, I'm Dr. Jim Hoven, your host of Health Matters at Ramos Law. Today, we're going to talk about headaches. If you've had them, you know that at the best, they're a distraction and they're a nuisance and they kind of take you off your game. And at worst, they can mean that you're out of commission totally for a day, sometimes even up to a week or more. I want to show you what the common characteristics are about headaches and how you can take care of them so that they don't wreck your life. Stay tuned, we're going to do that next. There are so many reasons for headaches, and if you've ever had one, you know what I'm talking about when I say they can be anything from a nuisance to a complete game wrecker. So what causes headaches? There's lots of reasons, and some of the more common ones are trauma and also overuse, and I'll explain overuse in a minute, but trauma is obvious. If you've been in an accident, a slip and fall, if you got hit from the side, or if you're a football player and you take a head-to-head crash in a tackle, all of those things can cause injuries to either the neck and or the head. Now, if the damage happens specifically inside the head, that's known as a concussion, also called a mild traumatic brain injury, or MTBI. And when those kind of headaches are in place, we've done a video on this before, so you can go check that out specifically, but you need to get treatment for that from a specialist trained in concussion type treatment. Otherwise, these symptoms can linger and go on, and they can be a real problem in your day-to-day functions. Now, another cause of headaches it's called cervicalgenic, and that means based or originating in the neck. So cervicalgenic headaches, they're from the muscles that come from the back of the neck on top of the shoulder blades and attach onto the base of your skull. And if those muscles get out of tension, so they're too tight, they're going to pull one side, or you can have the front muscles pulling down, and that chronic tension leads to what we call tension headaches. And we'll often see those occurring in the back of the head, and they can sometimes even radiate over into the front. Another cause of headaches is a misaligned or improperly moving set of vertebrae, like we would see here in the neck. So basically, if your head is from the side here, your nose is out in the front, and we look at these vertebrae right here, these cervical or neck vertebrae, if there's a misalignment or those vertebrae aren't moving correctly, it causes a stress response in the nerves leaving that part of the neck, and the nerves at the upper part of the spine go back up into the head. So if the spine is not moving right, that can cause damage to the muscles and to the sensory part, or what you feel in your head, giving you headaches. So those are just a few reasons for headaches, but there's also allergy headaches, there's toxic headaches. So if you're exposed to either mold or pollutants, if you've been exposed to bad air, bad water, all of these things can cause headaches. So the moral of the story is if you've got consistent headaches, ongoing headaches, persistent headaches, severe headaches, get that checked out by an appropriate provider. And especially since we mostly talk about trauma-induced stuff on this show, we're gonna focus there. For most trauma-based headaches, things like chiropractic, acupuncture, massage, physical therapy, in other words, conservative care, does wonderful. Just absolutely wipes out headaches in a very easy way. But sometimes if the damage is too much, the ligaments are really messed up, or if we have some other things going on into the brain, we need to look at other procedures, whether that be injections, even what's something called a radiofrequency, which is where the nerves kind of get burned. And we also need to check in the case of if we have internal reason for headaches, those MTBE headaches, we need to look at going to specialists like neuropsychologists, neurologists, people that can give medication and things of that nature. So if you have headaches, please get the appropriate treatment. And always remember, if you have a question, you can reach out to me, Jim, at ramoslaw.com. And until next time, remember, your health matters.